are about to start a CO2 laser skin resurfacing. These are great to help with fine lines, wrinkles, sunspots, pores, and it even gives you some skin tightening. What we like to use with our patients is this device here called Pronoct. It's a nitrous oxide device that makes the patient comfortable. So you'll see her breathing this gas during the treatment. And the laser I'll show you in a minute. Breathe in and out of your mouth, right through that hose there. In and out, deep breaths. There you go, in and out. So I'm just wiping off the topical numbing that we put on her to make it more comfortable as well. And that's been sitting for 30 minutes. And then we're just going to clean the skin off with a little alcohol swab. You're going to love the laser. My patient from last week just walked in. She did their second. You should see her skin is like beautiful. She's very same skin type as you, and she did too. She looks gorgeous. Her skin is like glowing. Now just keep your eyes closed. I'm just going to wipe with a quick alcohol swab here, okay? You may taste it or smell it. It's just the alcohol. And then we're going to start zapping you. We have a suction machine. Oh, that's the suction device that sucks smoke during the treatment. You feeling the gas? Pretty cool,
yeah.
Huh? So I want to show you examples. You can see that she has these sunspots here. They're all going to get better. She's got some of these fine lines. She has some of these lines around the mouth that will also get better. We use laser eye protection. The glasses have to be particular to the frequency of the laser. So these are made for the CO2 laser that we're going to use. I'm going to put these shields on the patient's eyes to protect her eyes as well. So you can keep your eyes gently closed. So these are the settings I'm going to do for her. There are different parameters on the settings. I can affect the density. The density, which is the number of spots per centimeter squared. So for her, I'm going to go up to 200 density. This is the power I'm going to use. I'm going to start with the 12 millijoules. If she tolerates it well, we'll keep it there. If she doesn't tolerate it well, then I can go down. And this is the wattage of the laser. I can go 30 or lower, but 25 is a good setting. The 120 here is the depth of the laser of the skin that's going to be treated. These are in microns. All right, here we go. You good?
Yeah.
All right, I'm just going to keep going, okay? We're doing 200 spots in this area here, and it does a random pattern to decrease any complications or risks from heating the skin up too much. The redness is normal, and this is charred skin. And you can see how the brown spots actually get darker. That's because they're actually going to fall off. If you want to take a break from the gas, you can also stop for a little bit, okay? If you're having a great time, you can keep doing it. So how about we do this? Let's stop the gas for a minute, and when the pain, and then just give me a minute, you come getting close to your mouth. I don't want to laser the gas, okay?
Okay, no problem.
The way we do the laser is we divide the face up into areas or subunits. So the big areas are the nose, the cheeks, around the eye, around the mouth, and the forehead. So that's the pattern that I follow when I do the laser treatments, just to make sure that I'm in the right area. And we've pretty much done her entire forehead, her nose, her eyes, and around the mouth. So next we're going to move to the décolleté area where she has some sun damage, and you're going to see the nice improvement she's going to get from that as well. When I'm on the décolleté part as opposed to the face, the skin on the décolleté has fewer glands. So I have to go a lighter setting so that the skin heals well, because sometimes the skin in the décolleté can take longer to heal. we're all done with that laser. You can see it's really nice refreshment for her skin. There is going to be a few days of downtime, so about 3-4 days of downtime, after which she'll just look like she had a bad sunburn. She'll take some antibiotics and an antivirus medicine, and she'll have some wound care to do. The pain is not bad. She will have some burning, with which she can use ice packs for it.